everything you need to know about a tummy tuck before your surgery. So long breast augmentation tummy tuck is one of my most common procedures that I do here in Honolulu, Hawaii as a board-certified plastic surgeon. Tummy tuck is a procedure where we take out skin and tighten the muscle, do some liposuction, rebuild the belly button, all those things to make an abdomen look more like it did before a woman has had children. There are some women who get this done before they have children. Those are usually women who have lost a lot of weight, either through diet and exercise or even bariatric surgery. That can also cause some of the changes that we see when patients have children. So with the tummy tuck, there is an incision. Incision is horizontal incision for the most part. It can be shorter in the case of a mini tummy tuck or longer in the case of a full tummy tuck. Sometimes we even extend that incision off to the sides of the abdomen so that we can take out more skin. Basically, you can think of this as the more skin you need to remove, the longer the scar needs to be. So if you need a lot of skin removal in your abdomen, you feel like there's a lot of loose skin there, it's very unlikely that you're going to qualify for what we call a mini tummy tuck. You're probably going to need a full tummy tuck. And I do have a lot of patients who ask, well, why can't I get a mini tummy tuck? It's really because of the degree of skin removal that's necessary. In patients who have a lot of loose skin, sometimes we actually do what's called a fleur-de-lis operation, a fleur-de-lis tummy tuck, which is a vertical incision which takes out skin, horizontal skin excess, as well as a vertical excess that's usually seen when we do a tummy tuck. We don't do that all the time. Patient has to be okay with that scar, but in patients with a lot of loose skin who need that kind of surgery, that does give a very good result. And it does have vertical scar as well. Most patients are getting a tummy tuck where there's a horizontal incision. One thing to ask your surgeon before going to surgery is, where is that scar going to be? And I would say the biggest problem that I see with tummy tucks that have been done by other surgeons is the location of that scar. Scar, in my practice, we try to hide and keep as low as possible. Goal in Hawaii is to be at the beach in a bikini with your kids and family after this kind of procedure, and if your scar is way up high where it's visible, that's never going to happen. And once that's done, it's very difficult to correct. So I think it's very crucial that you ask a surgeon where the scar is going to be, where he usually locates it, look at his before and after results, and make sure that scar is hidden in most of his patients. And in my patients, I keep the scar as low as possible so that it's hidden even under a two-piece swimsuit or bikini, which is very common in Hawaii. The other crucial thing that you want to ask is, what does the belly button look like after this procedure? And I have a lot of patients who come to me and say, well, I just didn't want to get a tummy tuck anywhere else because I've seen belly buttons from a tummy tuck and they never look right. The usual appearance is a ring of scar around the belly button which has been reconstructed, meaning the belly button's been cut out, so a cut's been made around the belly button has its own blood supply so it can remain attached to the abdomen, and then all the skin is loosened up or mobilized or surgically detached from the body around it. Then a surgeon pulls down the skin, takes out the extra skin, creates a new hole for the belly button. The belly button is brought out of that hole, and then things are sutured up. If it's done in the traditional way that I usually see from other surgeons, the belly button really looks like it's stuck on. There's a ring of scar around it. It never looks natural. Belly buttons don't have a ring of scar or any ring around them, and it can look really unnatural. It's a telltale sign that somebody's had a tummy tuck. Patients don't want that. So in some cases, I will rebuild the belly button, but I'll do it in a way so the scar is drawn inside the belly button so it's not visible on the outside, and the belly button is a nicer shape and it looks much better. Most of the time, I'm creating a brand new one, and there are many advantages to that. One is that there's no scar around the belly button. Even if you hide it, it can be somewhat visible in certain patients. The other reason why it's better to create a brand new one is that we can place it wherever we want. Sometimes the belly button is just too low, and too low belly button also makes the abdomen look more aged or not quite youthful in the way that we want. Also, the shape is better when we make a brand new one. It's more oval, it's elongated, similar to what a belly button looks like in a young patient. So I've really found that for most of my patients at least, making a brand new belly button is better than preserving the one that they had, and this gives a better result, and it's a much better looking belly button than what I usually see when patients come to me seeking a revision. The other aspect of the tummy tuck, which is very important to get the best result, is the tightening of the abdominal wall. And what I mean by that is that you have your skin, you have a layer of fat underneath the skin, and then under that is a layer of muscle. And the muscles there include the rectus abdominis, which is the six-pack muscle, and then there's some what we call external oblique muscles on the side, just different layers of muscle that create this very tough, what we call abdominal wall that holds all our organs inside. And that's a very important layer, as you can imagine, and it's generally quite strong and tough, and it does its job. But when a woman has kids, that layer gets stretched out, which is very common. It's not a health concern, just something that happens. Along with that, the ab muscles get separated so that they are a bit weaker and they don't function as well. And also gaining and then losing a lot of weight can also cause this laxity, because when you gain a lot of weight, you gain some fat inside your abdomen, everything gets stretched out as a result, and then when you lose weight, things just don't shrink back. So that looseness of that abdominal wall layer, of that muscle layer, does cause bulging of the abdomen. And women will come to me and say, I've had 4 kids, they're all large children, everything feels like I'm still pregnant. My abdomen is still kind of large and distended, and people will say very embarrassingly, I was somewhere and somebody asked me, when my baby was coming. So, they still look pregnant because of that layer being stretched out and the abdomen still being rounded. To fully correct that, what we have to do is we build what's called a double internal corset all the way from the rib cage all the way down to the pubic bone. So we are tightening that muscle layer to a completely flat configuration so that it looks like how it did before a woman had children. And that's a very important part of this procedure. If that's not done properly, a woman will have bulging of the abdomen, they'll still appear rounded, the abdomen won't be flat. All those things are necessary to restore the abdomen to how it was, and that's what women want from this procedure. And that's another reason why I might see a patient who wants a revision, just because that muscle work, that muscle repair wasn't done properly. If you like this video, please smash that like button, subscribe to our channel if you like this content so we create more for you. Next up is part 2, what you need to know before tummy tuck.